Okay, I'm getting ready to go with Jeannie to do an IV dressing change, and I thought we should just check in really quick about this process because IV sites are a potential entry point for microorganisms into the bloodstream.
That's why we use sealed IV dressings, right?
That's right. We do that to prevent complications. When these dressings need to be changed, it's important to observe meticulous technique to minimize the possibility of contamination.
Now, how often are IV dressings changed?
Well, IV site dressing changes often coincide with IV site rotations, usually every 3 to 4 days. Keep in mind that dressing changes might be required more often based on your nursing assessment and judgment.
Like any IV dressing that is damp, loosened, or soiled, it should be changed immediately, right?
Exactly. So why don't you two see to your patients, and Jeannie and I will head over to her patient. Okay?
Sounds good.
Miss Swenson, I brought that up because my patient's IV dressing isn't due to be changed for another day. But when I was changing the IV solution container and the tubing, I noticed that the dressing had become loose.
Well, you're right, Jeannie. We should change that dressing. So let's go.
Okay. Mrs. Markowitz?
Hello.
Hi, Miss Markowitz.
Hi.
We're here because your IV site dressing is loose. I'd like to change it for you now. Would that be okay?
Please do.
Okay, I just need to check your ID band. Can you tell me your full name, please?
Sharon Markowitz.
Okay. I'm going to turn off the pump and clamp the line. Okay. Could you put your arm up on the table for me?
Sure.
Now I'll place this towel underneath your arm. Great. Now we can get the dressing off.
Be sure to leave the tape that anchors the IV catheter in place, Jeannie.
Okay. You okay?
Mm-hmm.
Okay, now when you loosen the tape holding the catheter, be sure to use your other hand to hold the catheter in place, okay?
Okay.
Do you need an adhesive remover?
Now it's coming right off.
Okay.
Now I'll cleanse the entry site using friction for 30 seconds. And let that dry.
All right. Now you can apply a new sterile tape strip to the IV catheter at the entry site. Then the transparent dressing.
Now for the label. Date, time, and initials. Now I'll apply the label. And I'll secure the tubing. Now I can open the clamp, turn on the pump.
Thank you.
Does everything feel okay?
Feels fine.
Okay, just ring if you need anything.
Okay.
Thank you, Ms. Markowitz. Nice work, Jeannie.
Thank you. You did good. Okay, I'm going to get this out of the way. Okay.